and get started. So, welcome everyone to tonight's monthly Medicare for All Resolutions Coalition webinar. My name is Melinda St. Louis, and I am the Director of Public Citizens Medicare for All campaign. We are working with a broad coalition of national partners in this coalition effort to pass local resolutions in support of Medicare for All. This is now our third national webinar that we've held since the isolation began of the COVID-19 pandemic, and it really still doesn't feel real to me that these are the times that we're living in. It's just time is passing, and it's really shocking in many ways. But today, the United States, as folks know, hit the grisly milestone of 100,000 COVID-19 deaths. And we have now hit more than 41 million people who have filed for unemployment since this pandemic began. And that means there are estimates of 27 million to 43 million people who will lose their health insurance due to the recession because the United States stands alone in being the only country among our peers that ties health insurance to employment. And we're seeing that the health disparities by race, income, and geography that are a result of our inequitable healthcare system has meant that Black and Brown communities have been vastly disproportionately harmed by this pandemic. And so what we're seeing is that this COVID-19 pandemic has laid bare just how broken our fragmented for-profit healthcare system is. And I think if there can be a silver lining at all to this, it would be that our communities come together and demand from our elected leaders to stop dragging their feet and to work to transform our healthcare system finally, so that every person has guaranteed access to care during this pandemic and beyond. The pandemic has created many new challenges for organizing, there's no doubt, but we've also been inspired over the past couple months by the tenacity and creativity of local activists like you all over the country. And these renewed efforts to educate the public and elected officials and to win local resolutions have made important progress just in the past few weeks, and we are really excited to celebrate those victories and to learn from them this evening. We are honored today to have with us Representative Judy Chu from California, who's one of our Medicare for All champions in Congress. And she's also been a leader during this pandemic in pushing for critical assistance to immigrant and vulnerable communities who've been affected. And we'll also have the opportunity to hear about the recent victories this past month in passing local resolutions in Medicare for All in New Orleans and in Ann Arbor, Michigan. And we welcome New Orleans City Council President Jason Williams with us, as well as national healthcare experts Marti Garza, who's the director of the Machinists Union Healthcare Department, and Dr. Abdul El-Sayed, who's a physician and former public health administrator in Michigan. We'll get updates from additional successful organizing by local leaders around the country. So remember that you can write any questions you have in the chat box, or you can, if you've called in, you can email medicareforall@citizen.org, and our panelists can try to respond in the chat box, or if we don't get to them, we will get back to you and answer your question afterward. So let's jump in. First, as I mentioned, we're honored to have with us U.S. Congresswoman Judy Chu, who represents California's 27th District. Representative Chu is the chair of the Congressional Asian Pacific American Caucus in the House, and she's a member of the powerful Ways and Means Committee. She helped to make strong case for Medicare for All during a Ways and Means hearing last year. And again, Congresswoman Chu, thank you for joining us tonight and sharing your insights with us.
Well, hello, and thank you so much for having me on today's webinar. It's unfortunate that the coronavirus pandemic is keeping us from meeting together in person, but it means so much to me to know that despite social distancing requirements, you are still finding ways to mobilize and push for Medicare for All. And it couldn't be more important since, as the pandemic has shown, everybody's access to healthcare matters now more than ever. The COVID-19 pandemic has put into stark relief the need to ensure that everyone, no matter where they live, what their background is, or where they work, has access to quality health care. During a pandemic, a virus doesn't care if you get your insurance through your employer or if you have a pre-existing condition. All that matters is that you have the ability to see a doctor and take care of yourself. And that is the philosophy behind Medicare for All. And that is the reason why when Congress passed the Families First Coronavirus Relief Act, our first bill, we ensured that anyone could get tested for COVID-19 without having to worry about copays or coinsurance. This was essential because we needed to make sure that no one skipped being tested because they were worried that they couldn't afford the bill. When we're in the middle of a pandemic, it's essential that we figure out who is infected and where the virus is spreading. And worrying about the cost of healthcare should be at the bottom of the list of concerns. And that is why House Democrats included in H.R. 6800, the HEROES Act, a provision that would ensure that treatment for COVID-19 would be free for anyone, no matter what type of insurance you have or no insurance, and no matter what immigration status you have. But unfortunately, we've seen that far too many being unable to afford necessary health care, well, they face that reality every day. And this doesn't just matter for containing and defeating coronavirus. The lack of insurance perpetuates inequality and leads to worse health outcomes and higher health costs for all of us. Here we are, one of the wealthiest countries in the world, and yet for many, affordable health care remains out of reach. In my district, there are approximately 40,000 people who are still uninsured. And for so many, even if they have health insurance, they are just one medical emergency away from financial ruin. And that's why we need Medicare for All. Medicare for All means even more today with the pandemic. It's something that we desperately aspire to, coverage for all, because coverage for something like prescription drugs doesn't mean much when the prices of those drugs are out of reach. Right now, we don't have a treatment for COVID-19, but many pharmaceutical companies are working on finding drugs to treat this disease, such as remdesivir, which has some promise. Well, can it be affordable? What Medicare for All would do is allow the government to negotiate for the price of prescription drugs, which would ensure that these life-saving drugs are not just available for the wealthiest among us, but for everyone. And it ensures coverage of preventative services like vaccines, which we know will be essential once one is available for COVID-19. What's more, Medicare for All is especially important for communities of color, and that is something we are seeing up close when we see the impacts of COVID-19. The mortality rate for Black and Latino Americans who contract COVID-19 is multiple times higher than that of white Americans. And initial data suggests that this is partially due to underlying conditions like access to healthcare. We are seeing disparities in the Asian American Pacific Islander or AAPI population as well. Pacific Islanders in particular are seeing infection and mortality rates 3 to 4 times higher than their representation in the population in my state of California. And the reason is not a mystery. Communities of color are more likely to be uninsured or underinsured, which has left them more vulnerable to infections like COVID-19. The coronavirus is showing the world what Medicare for All supporters have known all along, that we need a healthcare system that works for everyone, not just the few. Well, healthcare is a human right, plain and simple, but in order to reach a future where Medicare for All is a reality, we need everybody to come together. I can tell you, I have seen how passionately people feel about their healthcare. I do remember at 2017, at the beginning of Trump's presidency, when we thought the Affordable Care Act was done for, we saw a grassroots movement unlike anything I've ever seen before in Congress. People flooding the offices of the members of of the House of Representatives as well as the senators. The switchboards for our phone lines lighting up with hundreds of calls from constituents worried about their health care. There were so many calls that the phones actually broke down the switchboard. Well, I tell you, all that pressure, it worked. But we will need that same passion again if we want to not only protect healthcare, but expand it. And we need to be informed, and we need to know what is going on, which is why this webinars like today are so important. So thank you for having me here today. Thank you for all that you're doing to inform yourselves and others. Together, we can fight for a future where Medicare for all is the law of the land.
Thank you so much, Congresswoman Chu, and thank you for your leadership in Congress and all that you're doing. We know that it's really difficult what you all are up against right now, and we're so grateful for your leadership. So thank you so much.
Thank you.
And we're going to be the foot soldiers to get there. So thank you so much. Now I'm really excited to welcome our next two panelists from New Orleans. For those of you who joined us last month, you may remember that there was a medical student, Ashley Duhan, who gave an update on the ongoing efforts by activists in New Orleans. And we were thrilled that since then, the New Orleans City Council, by a unanimous vote, took a stand in support of guaranteed health care during the pandemic and Medicare for all. So we're really lucky tonight to have D-Calif, who's a medical student from Tulane, who helped to organize that for that victory, and New Orleans City Council President Jason Williams, to talk about the significance of this important resolution that happened just a few weeks ago. So Jay will tell us about their organizing and introduce Councilmember Williams. Jay?
Hello, as she said, my name is D-Calif. I'm a student at Tulane. I grew up in New Orleans before leaving for a while. And thank you everyone for joining tonight. Thank you, Melinda, for having me. I'm so honored. Thank you, Representative Chu, for laying out so clearly the reasons that the people in the coalition that I'm a part of believe this is important. And again, like you said, not just during the pandemic, but beyond. So I am a member of this fairly young healthcare coalition in New Orleans that we'd been working for a few months in efforts to support Medicare for all since before the pandemic began. And what's really important though about the coalition is that we were able to build, I'm a member of the American Medical Student Association. Ashley Duhan, who was just mentioned, is a member of Students for National Health Plan. We had members of the DSA, some mental and physical health providers, social workers, debt relief counselors, and others who, I believe, just from the goodness of their hearts, want to see everyone have fair and equitable access to healthcare. There are way too many people named that worked with me, but I also like to say thank you to Francis Gill's tireless organizational efforts for keeping us on a track, on schedule. So we were debating how to do this and how to rally, especially healthcare providers who see the problems in the system before the pandemic, to our cause, which is not always a popular one because we're asking for change before this, but excuse me, I want to just give encouragement, I guess, to community members from other cities, whatever your day job is, as students and doctors, you've got a voice, but as, oh right, we've got the leader of the Mechanics Union. Sorry if I've got that wrong here tonight. You know, anybody in your life can have a voice if you come together and build a broad coalition of people who care about ending some of the systemic inequities that we've had. So we were working on this, like I said, before the pandemic began, and it's just really exacerbated everything. So we grieve with everyone else the tragedy that is bringing this issue to a national light. But we're very fortunate that the New Orleans City Council sees the problems, and especially, you know, we're a tourism-based city. We're going to have a rough go of it possibly for a while, but saw the problems and listened to our plea and others, and took up a resolution to support this I've never had the pleasure to meet you, Council President Jason Williams, but thank you very much. I'm just so grateful and relieved that things have gone as they have down here when it could have been worse, as we were one of the early hot spots. So I'll try to answer questions later on community organizing. I'm kind of new to it, but like I said, I want to try really encourage everyone who has an interest in this to take part. And I would advocate that we all have an interest in this, because healthcare is a public health issue, and that should be a public good. So thank you again, Mr. Williams. I'd like to turn it over to you. Couldn't happen without you.
Well, Jay, it couldn't happen without you and without your group and without the people on this call. I mean, I'm just a city councilman. Sometimes we're dealing with a tree that's growing in someone's yard, or a house that somebody doesn't want built too high, or sometimes it's things very, very serious when, whether it's a medical student or a scientist or a doctor calls, and I listen to my own doctor, because I want what's best for my health. And I listen to a doctor when he talks about what is good for the health of my community, and I listen to that. So Jay, it's good to see your face. I haven't seen it before. The Zoom call lets me do that. Before I was in the council, I'm a criminal defense attorney, and I fight for people. And that's exactly what Jay was doing and is doing, and what the people on this call are doing. My work has largely centered around criminal justice reforms, reducing racial and economic disparities in the criminal justice system. This is not very different from that. And increasing government transparency, in addition to the use of data in guiding our decision-making in the criminal justice world. And as we've worked our way through this pandemic, we have relied on data and science. And I think that is what government is going to have to do moving forward in all things. I was invited to join to share what led the New Orleans City Council to pass this resolution to support Medicare for all. So let me just dive into that. These folks reached out to me at a time when we saw the city of New Orleans looking a whole lot like Italy. Not like another part of the United States, but like a place where the rate of spread was high. And thanks to our hospital system that was in place that put egos on the side and really worked together regardless of what system they were in, public or private, we showed some very real signs of flattening our curve of COVID-19. And we had passed the plateau, and we knew that the goal at that point was to maintain the gains that we had made because of social distancing and the like, but largely due not to government, but to healthcare workers who were sacrificing infection themselves and for their families, and healthcare systems that work together to help people. And, you know, New Orleans was reeling from losing a number of highly cherished community members. A good friend of mine, Ellis Marcellus, the patriarch of jazz in our town. His sons, Wynton, Delfeo, but at NOCA, he taught countless more. He passed away because of this. He's a friend of mine, culture bearer. And New Orleans is a very unique place to live. Like Jay, I grew up here, I had a chance to leave and come back. And so it allows you to see your warts and moles a little differently once you've had a time to see how other people live. And our essential workers, whether you talk about someone who is cooking your favorite meal or someone who is checking you out in a grocery store so you can cook your favorite meal. A lot of folks did not have the option to do the Zoom call we're doing now. They didn't have the option to stay home, and they were hit very, very hard. Our transit drivers, our janitors, our garbage men, people who we normally don't even think of. We're just, I mean, I can tell you when I take my garbage out twice a week, I barely want to do that, let alone deal with that. And so these people have proven themselves essential to us just living our lives. So those folks were hit really hard in our city. And we're a poor city. which means we have a lot of people that are living in this sort of category of working poor, meaning you're busting a hump every single day, sometimes 2 and 3 jobs just to make ends meet, but you're still below the poverty line. And so these folks were experiencing an unimaginable job loss as well. Our Louisiana, the state, not just my city, were suffering one of the worst racial health disparities in the nation from COVID-19. Mortality rates, fatality rates were painfully evident. Some of the news reports and commentary were linking the death rates in New Orleans to pre-existing conditions. And some folks talked about these pre-existing conditions like they were a choice. Like you because of what you ate, because you didn't take yoga classes, you have these pre-existing conditions, regardless of the fact that it is easier to buy a loose cigarette from a corner store than it is an apple or orange juice. So the lifestyles that we have dealt with in our town, the food deserts in huge parts of town, this is what's to blame, not the choices that people make, because people don't choose where they can afford to buy a home or rent a home. But the virus left and impacted, as you said earlier, Black, brown, and beige residents of New Orleans devastated. And it was quite frustrating, to be honest, when you see newspaper headlines saying, why is it affecting these people in such a way? And then the push to reopen. You know, let's talk about that. It wasn't until there was a conversation about who was affected most, poor people. Not just Black, brown, and beige, but poor people were affected most by this. Then there was a push to reopen, which is very callous in terms of who we care about and what we need. The push to have chicken and meat manufacturers reopen despite the numbers that were there. So the prevalence of pre-existing conditions is, of course, as this group knows, high among our poor community. But these folks didn't ask for these circumstances. And they certainly didn't ask for decades of discrimination in jobs and housing and policing and education. And certainly they didn't ask for these disparate outcomes in their healthcare settings. They didn't ask for the long-term impacts of stress and trauma, because mental health is a key component of healthcare and should be talked about the same way we talk about cancer. And so when we talk about food deserts, lack of access to jobs, paid sick leave, and lack of consistent health insurance coverage, or the economic realities of being able to get off work to go see a doctor when you aren't feeling good. The medical students that came to me made it very, very clear that the time was now to strike this chord, to have this conversation, because people love to see others as other, whether it's poor, whether it's beige, whether it's brown, whether it's gay, whatever. We love this sense of other. But now we're all masked. We all have this mask. We all look like other. We all realize that the poorest person, be it he, be it she, be it they, be them brown, be them beige, can affect my health. Whether I am a billionaire living blocks away from poverty, now the poorest person in my town, his health determines my health. So these medical students were dead on when they said now is the time to seize this moment that Senator Sanders and others on this call have been fighting for a very long time. And as an elected leader, I saw this as not just an opportunity, but as my obligation to bring the New Orleans City Council and to encourage other city councils to pass similar resolutions so that there is this overwhelming support for something that is going to help us all. And when I received the email from this group of medical students advocating for universal comprehensive healthcare coverage, there was no question about whether or not they were right. The question was about how fast I could move and how fast I could move other city council members in other cities that I know to move just as fast. I am inspired by these future medical leaders. It certainly was timely. It certainly was the triple truth, Ruth, and we passed it overwhelmingly. We passed it overwhelmingly because we saw the impacts of not having it. And simply put, I mean, we have it now as it relates to COVID-19. The CARES Act said we need to pay for this because it is going to cost people more than their house costs, more than their car costs, to pay for healthcare coverage if they're hospitalized from COVID-19. So what that proved to us is that we as a country, we as one of the richest countries, we can afford it, right? We can afford it. And if we had done it sooner, we wouldn't be where we are today. I mean, COVID-19, despite President Trump's failures to read his emails, to listen, despite all of that, had we had universal healthcare coverage before this, we would not have the number of American citizens living with these pre-existing conditions that we have now because of preventative maintenance. So it's abundantly clear. I recognized pretty early how big this could be for the city of New Orleans. We have a Democrat in our governor's mansion in our Republican state who accepted Obamacare overwhelmingly, and that is why it wasn't worse than it was here in the city of New Orleans. So in the midst of our shutdown, I started asking the community members to reach in and to weigh in and talk about how we could make New Orleans better than it was before, how we could reimagine what it looks like for our hospitality workers. Because as Jay said, we're a tourism town, which means we don't just deal with our local population. We have a transient population coming into the city of New Orleans on a very regular basis, bringing with them their dollars and their infection. And we have poor people who wait their tables, clean their beds, clean their bathrooms and hotel rooms, who risk taking that infection back home with them. And so we've been fighting to provide healthcare for hospitality workers, and we put that in place before, but it's not just that. This is for sanitation workers. This is for garbage men. This is for every single person in the city of New Orleans and in this country. And one day the people who are fighting against this are gonna realize what this did for them. And selfishly, one day Fox News will trumpet how great this move was, and they'll probably claim it as their own. So this is not something the city of New Orleans typically delves into. When Jay and his group reached out to us, it was something that all of my colleagues readily ran to and asked that their names be added to. It is something that they're going to help me fight for throughout the rest of my state and throughout the rest of this country. And our national level elected leaders and officials not only have an opportunity, but in my opinion, they have an obligation and duty to chip away at the root disparities that leave countless Americans unnecessarily vulnerable at times of crisis. This is our first global pandemic, but based upon what I've heard from Dr. Fauci and others, this may not be our last. Yeah. I think the fall is going to be very tough for a lot of us. And my colleagues with me on the council believe this is time to mend a broken healthcare system and do what we should have done a long time ago. So in closing, I just want to say thank you to the students, Francis Gill, Jay Cliff, Ashley Duhan, for their partnership and their advocacy in making me a better leader. And I want to say thank you to the folks on the national level, Senator Sanders, Representative Pramila Jayapal, and others who have been fighting for this for years so that we can get to where we need to be for all Americans. Thank you.
Thank you so much, Council Member Williams. We're so grateful for your leadership. We're going to make this recording available, and I've seen throughout the chat that many people want to use this video with their city councils to encourage them to do the same. And so thank you again, and we will definitely be staying in touch. And I think the it's the groundswell of local governments around the country who are closest to what's actually happening on the ground that can really be a very powerful voice to our federal elected. So thank you.
Please send me those council members' numbers so I can cold call them and make this case.
Oh, that's fantastic. People are going to be thrilled by that. Thank you so much. And thank you again for your leadership. So now I want to turn it over to another really powerful national leader on healthcare, Marti Garza, who is with the International Association of Machinists and Aerospace Workers. He is the director of their healthcare department, and Machinists Union has been a very important partner in the national coalition effort. So Marti, if you'd like to share a little bit about the pandemic's impact on labor, the labor movement, and any insights you have around how we can organize on Medicare for All.
Yeah, absolutely. Thank you. So as Melinda said, I'm with the Machinists Union. We're 600,000 active and retired union members. We're one of the largest manufacturing unions in the United States. The majority of our membership is in aerospace and avionics, as well as the airlines industry. And we're also the largest defense contractor union in the United States. And I guess for us as a union, and then I'll speak to us first and then the rest of the brothers and sisters in the labor movement. The pandemic has really exposed the shortcomings of employment-based healthcare. You know, we have the privilege of representing working men and women in America, bargaining good, strong collective bargaining agreements, contracts for them that, you know, guarantee them a certain level of health benefits. But oftentimes these health benefits come at the cost of negotiating stronger, bigger raises or other benefits, quality of life benefits and economic benefits in the contract. And that's all well and good when you have your employment and you're able to access your health insurance. But when you're laid off due to an unforeseen crisis like this pandemic, it really just throws your entire personal situation a kilter. You know, and as good as the contracts are that we negotiate, if you know, we've had, you know, roughly 80,000 and counting members furloughed or laid off, we've had to go to the bargaining table to try and force these employers to maintain health insurance benefits for our members throughout the furloughs and layoffs for a certain period of time. But the truth of the matter is that despite the CARES aid package that's gone on, despite all these other packages, you know, not all employers are going to be good partners and bring our members back. And our members are going to be left with the short end of the stick with no health insurance to protect them and their families. And that really drives home the point for why we need to decouple health care and health insurance benefits from the employment system. You know, and this has been a tremendous opportunity to educate our members and our brothers and sisters in the labor movement that, you know, while we have been able to negotiate some of the best healthcare benefit plans in the country by virtue of being a strong militant union, that can all vanish in an instant from a crisis like this. Take a look at our brothers and sisters in the at Unite Here, the hospitality industry union. They've lost 98% of their membership. You know, to hopefully temporary furlough. They have been a leader in negotiating Cadillac healthcare benefits for themselves. But many of their members, right, their industry is going to take a long time to recover. And those benefits are going to take a long time to come back. So I think the pandemic, the COVID-19 pandemic has been a bit of an eye-opener, I'm hoping, for my brothers and sisters in labor to understand that it's not enough to build islands of power in a sea of uncertainty. It's not enough to take a fortress unionism model where we are able to have things that most Americans do not by virtue of having collective bargaining agreements. And it's time to seriously rethink where we put our energy and what would it mean if we had Medicare for all in our country? What would it mean for our members in terms of the other benefits that we could bargain for them, and what would it mean for our members' families who aren't lucky enough to have a union and who depend on the health insurance that they have from our members to take care of their families. And now that our members have lost their health insurance benefits, right, it just has a cascading effect. So, you know, while working America has borne the brunt of the pandemic, right? I think that the silver lining in the dark cloud is that it's really galvanizing a more critical look even among union brothers and sisters who normally thought of as Medicare for all as, well, that's something for other folks, right? For folks who don't have a union or, aren't in an industry that's organized. But really it's like, wow, we are all in a tremendously precarious position that's been exposed by the pandemic, exacerbated by the woefully unprepared administration that we have. And it's time to really think of a different way of securing healthcare, right? And thinking of healthcare as a human right, as a fundamental right for all Americans, not just as a privilege for those who are lucky enough to have a union. Again, we're proud to be one of the leaders in the labor movement on the fight for Medicare for all. We're part of Labor for Single Payer. We're advocating on Capitol Hill and in state legislatures to gin up support. But if nothing else, the crisis has given us an opportunity to engage with our brothers and sisters in the labor movement that maybe were not quite there in the past, but now their membership has been affected in such a stark way, and really sort of begin to have a conversation about why Medicare for all matters. It's not just some pie in the sky policy proposal. It would make a tremendous difference in the lives of definitely our working men and women that have been laid off, and those of us in our sister unions in the AFL-CIO.
Thank you so much, Marty. There were a few questions in the chat, so if you want to take a look there, if you could answer them, that would be great. I do want to move on, but we're so grateful for the Machinists Union and for your leadership in this movement, and thank you again so much for sharing your expertise with us. Next, I want to invite Lauren Sargent, who's with the Michigan for Single Payer Healthcare, to report on a successful effort that she helped to lead in Ann Arbor. The most recent city council to pass a resolution was Ann Arbor, just I think early last week. So Lauren, share a little bit of an update of your work.
Thank you, Melinda, and I feel humbled to be in this company because our job was actually relatively easy, and I guess that's a silver lining of the pandemic. The way that I look at it, it's like a crime scene when you come in with the UV light to see where the blood is, and this pandemic surely showed us where the blood is. So the big arguments against Medicare for all, the whole, well, if you like your health care, you can keep it. Well, not when 26 million people at that point on April 22nd, when we introduced the resolution, had just newly filed for unemployment. So much for that argument. And the whole, how can we pay for it argument? Well, we just threw trillions at the financial system and big corporations. So in a month. So there goes that argument. It was also a very good time in the budget cycle because the city is now looking at red ink like everybody is all across the country. Cities, counties, state governments, etc., are all trying to figure out what on earth to do with massive budget problems in the face of huge human needs for real relief right at home. So this is, of course, if we pass Medicare for all, that would be a huge relief to city budgets. And it's something they're going to have to be struggling with, is maintaining health care benefits for city employees. So this was an argument that made itself. And I was fortunate to have some relationships with city council people who I already knew had worked with on other things. And that's some advice I would give, is get to know your city council people before you run in with a resolution. Find out who already is on your side and what do they care about. So, so this was surprisingly easy. And I worked with one city council person, the one who introduced the resolution, Jack Eaton, who is a retired labor attorney and has been in on many contract negotiations, including benefit negotiations. And he did a lot of the work for me without me even having to ask. So we didn't even get to the point like you did, Jay, in pulling together this big coalition and so forth. That was in the plan, but it turned out we didn't need to do that. And the council members were falling all over themselves to be supportive. We only had one no vote, and that was a council person who now calls herself an independent, but she was a Republican. And she, I don't believe, well, she usually does her homework, but I'm not so sure she read the resolution, because her argument was just, well, how are we going to pay for it? Well, we, the city, is not going to pay for it, for one thing. And it would, of course, help us on every level. And so it was surprisingly easy. And I loved it as a person who's been working on single payer for years and working at the state level, looking at plans like Dr. Abdul El-Sayed's state level plan when he ran for governor. The other part of the resolution that we passed was not just Medicare for all, but also there's a state bill, MyCare, which is similar in some ways to what Dr. El-Sayed was proposing, that would be a single payer at the state level, and that was passed as well. So this was a matter of people wanting to come together to agree on something that would clearly be a benefit to everyone, and there was absolutely no argument against it. So.
Great, thank you so much, and it's really inspiring. Just a few weeks ago, we had there was a statewide call around Michigan, around the resolutions, and just to see the momentum starting. And we've heard that even Pittsfield might be interested in taking a cue from Ann Arbor and seeing the snowball. And it's just, so thank you so much for all that you've done. And I encourage others to pick the brains of some of these activists who have been successful. Now I'd like to turn it over to Brittany, my colleague, public citizen, who's been organizing and talking to folks around the country to share a few tips and introduce a couple of our other activists to give quick updates.
Hi, everyone. So yes, the last few weeks have been really busy, and we've been hearing from council members all the country who have been signing up to work on resolutions, which pays testament to the momentum of our movement. I spent a lot of time talking to you individually about some of the strategies that have been working for moving resolutions forward in the midst of social isolation. And so we've added some new resources to our toolkit, which I'm going to show you. If I have I do. Great. So our website, medicareforallresolutions.org, there's a link right there in the top that goes straight to our COVID resources. And just quickly to point out that we had put together a bunch already that include a guide to writing an op-ed, a list of resources and fact sheets about the coronavirus and Medicare for All that you can use when speaking to your council member and if crafting an op-ed, as well as some sample resolution language that was based on the resolution that New Orleans passed in support of both Medicare for All and the Health Emergency Guarantee Act. So to that we've updated our detailed timeline and set of instructions for passing a resolution, which you can see here, as well as we now have a model email request that you can send to your council member as well, that makes some points about the pandemic. So that's it for me for now, but always feel free to get in touch with me. I am living with my parents, so I would love to talk with you right now. Thanks so much. Bye-bye.
Great. Thank you, Brittany. Now I want to turn it over to Carolina Ampudia from South Florida, who helped to organize an exciting car caravan and very creative action. So if you want to give a quick update about that, Carolina.
Hi, everybody, and thank you, Melinda, and everybody for having me. I'm here representing a crowd of people that is very active and extremely supportive of Medicare for All. A good friend of mine is in the other side of the webinar. His name's Michel Stolberg, and you know him. He's been an activist for Medicare for All forever. There's a whole lot of other people that are behind it, and when we started looking at ideas of doing something related to these, we didn't want to do any kind of mobilization that was going to first put us at risk and also give the wrong message, right? We didn't want anything that was going to be on the streets and that was going to say we need more health, and then we're exposing ourselves and others in this effort. So that was out. So we started thinking of caravans, and the first idea of the caravan was just on Medicare for all. But when thinking on mobilizing only in that way, especially at that beginning of the pandemic, when all of us were feeling frustrated, it felt like we were going to go on a negative aspect very easily. And so one of our members, or one of our leaders, she proposed that we did another angle, that we shifted into a gratitude caravan for all healthcare workers and essential workers, that because of showing us what really means to work on out of the calling that we as healthcare people have, right? So the idea continued like that, and we decided to move on to that, and like that was the best approach, because it was not just going to be like a democratic thing or a Republican thing or anything. It was not politically related. It is using that advantage that we have of having the 69% acceptance at this moment and increasing, and that people are really seeing the necessity of a universal healthcare plan. And I actually do not completely agree that the inequities of healthcare are only linked because we are linking employment to healthcare, but it's actually a symptom of something much more deep, and that it's related to all of the inequities that have existed for a very long time, the xenophobia and the racial injustice and the classism that we live in our countries, and that idea of having healthcare because of a union or because my employer is a very selfish way of implementing things. You know, it's, if you have healthcare because of that, then good for you, but guess what? Your neighbor can make you sick because they are dying next door, right? So you have to be very mindful of that. So anyway, the idea of the caravan continued like that. We decided to do a very long route. It's more than 30 miles on a caravan. And so people were even texting us, you're crazy, this is never going to happen, people are not going to show up. And we continued pushing with that. So we did 3 loops around Jackson Memorial, and all of us had messages on our windows, and everything was like, healthcare is an act of love, which is the name that we gave to the group. And we wrote things like, thank you, superheroes, and healthcare is a human right, and, you know, and on the megaphones we had music and also messages of like thank you and voicing the necessity of a healthcare system that protects everybody. Around the 3rd loop, we came back to our grounding location where we met at the beginning. We had like a prepared speech that was already recorded, and so that we were not exposing too much outside. And then we drove to the VA hospital. If you're familiar with that area, it's just next door to Jackson. And then we went downtown Miami, and then we drove all the way up to Broward Medical Center. That's on the northern part of Fort Lauderdale. So it was a very nice ride. We did another 2 or 3 loops around that hospital, and then we ended in something that was very, I think, unique and risky as well. that was a Zoom event that lasted an hour. And we had the pleasure of having Dr. Bill and Melinda speaking there with us. And we had people from physicians for the National Health Program, and we had DSA people, and we had elected officials, and we also had candidates for Congress. So that was a very nice surprise. One thing that I can tell you of that is that I do think that it's always important to end mobilizations with some sort of like concreting the idea and putting together that. But in hindsight, for our next caravan that's going to be in June 10th, we are not going to have the person who's running the Zoom event connecting mobile with us because we had a few connection issues. But so that person can be an activist that cannot make it, or a designated stay or something like that. So that you have one person that has a stable connection that it's running, but all of the speakers and all of the participants can be mobile. And as long as you're not leaving your car or crowding too close to each other, you're fine, right? So that's basically what we did.
Wonderful. Thank you so much, Carolina. It's really inspiring and it's really creative, and it was really cool to be a part of it. And it's great to hear that you're going to be doing more. And I know others from around the country have already asked, tried to get advice from you all. So that's fantastic. Next, I want to get a quick update from Noelia Rodriguez, who's with Our Revolution, Michiana, which is also a very important partner, Our Revolution, in this effort. And some of the efforts they're doing in South Bend. Before we, and I do want to let folks know, we have Dr. Abdul El-Sayed after her to wind us up. So, Noelia.
Thank you. Yeah, I see we're running a bit behind schedule, so I'm going to make this quick. I set up my stopwatch. So being in Michiana, we cover a pretty large region, several counties in Indiana and a couple of in southwestern Michigan. But our base is in South Bend. And so ever since we had our summit, our Organized to Win Summit back in December of last year, we've been talking about getting a local resolution done here in South Bend and basically sparking that fire in the region, hoping to replicate it in neighboring cities. But we also endorsed a candidate for our upcoming primary, which is June 2nd. So that's been keeping us busy. Drew Duncan, who's also a very strong supporter of Medicare for All, that's for State House. But I'm very happy in the midst of all of this planning and campaigning as well, that I've recently caught word that we have a city council member, Henry Davis Jr., who's extremely interested and supportive in introducing this resolution. So I'm hoping, as with Lauren Sargent's effort in Ann Arbor, that this will go smoothly, and we're very excited to collaborate with that city council member, and also excited to work on other projects that will be, the plan is that will be the cornerstone for a poor people's agenda. So touching on the ideas that Councilman Williams brought up earlier. So we're super excited, to be planning along for this. And as soon as the June 2nd primary is done, we're going to have Councilman Davis Jr. Join us in our next planning meeting. And we're hoping to be able to have this introduced by next month. Thank you.
Wow, fantastic. That's great to hear as well. And as folks are hearing, this is happening all over the country, big towns, big cities, small towns, rural areas, urban, and that's really what we need to build this movement. And so now I'm thrilled to welcome Dr. Abdul El-Sayed, who is a physician, epidemiologist, public health expert, and progressive activist, and contributor at CNN, and he's written books, including visiting, co-authoring a book, Medicare for All, A Citizen's Guide. Dr. El-Sayed, to close us out, can you share some thoughts for grassroots activists on the pandemic and how you think we can continue to build this grassroots movement and in the coming months and in the future?
Absolutely. Well, first of all, thank you so much for having me. Really excited to be with you all today. I want to just give us some context. The COVID-19 has found its way into the crevices of American healthcare in some pretty profound ways. Number one, the dangers of tying healthcare to employment when people are losing their jobs left and right. Number two, the fact that we have hospitals that are reliant on reimbursements from elective procedures that then get canceled in the context of a major pandemic, who are now fighting a pandemic and fighting bankruptcy at the same time. And then number three, the fact that 10% of our population, who tended to be the most underserved and the most at risk, didn't have healthcare in the first place. And even if they did, 50% of people won't have the paywall rescinded. That is their deductible. I mean, if you think about it, a deductible is a paywall for the healthcare you already paid for. That paywall doesn't drop until May 19th, which, you know, the Kaiser Family Foundation calls Deductible Relief Day, the day when the median American pays down her deductible. And so it's shown us how broken our healthcare system. The fight for Medicare for all does not end. It cannot end. And it never was one candidate, as much as that candidate has done so much to advance the ball down the field. So I want folks who worry that that fight has been put back, just to take heed from all the incredible grassroots activists who've been fighting that fight on the ground in their own community, including Lauren. I don't know if she's still here, but, you know, thank you for all the work that you've done. And I was really glad to be able to work with her when I ran for office in Michigan in 2018. And so that fight continues. It just takes a number of different forms. I want to be clear about a couple of things. The unitary fight for a single payer healthcare program across the United States and across individual states, that cannot end. That has to continue forward. But when we think about where we sit between now and in November, I don't want us to forget the fact that we are dealing with a pandemic that has killed 100,000 of our countrywomen and men, that it has fundamentally devastated our economy, and that is because of the failure of leadership that we have seen at the federal level. And so I want us to remember that when we think about where we head from here, even if the stated aims may not be Medicare for all, let's not forget that we have a responsibility to fight for the values that we stand for, and to make sure that even if we're not playing offense on the issues that we want to see done when it comes to American healthcare, passing Medicare for all, sometimes you got to play defense. And, you know, I always tell folks that I would rather be fighting for Medicare for all in 2021 than fighting against ACA repeal. I'd rather, you know, in beyond healthcare, I'd rather be fighting for real immigration reform than fighting against a wall. I'd rather be fighting for a Green New Deal than fighting against the repeal of climate policies that are currently on the books. And so I think we have a real responsibility to leverage this moment to realize that, you know, it may mean that we go out, you know, to use a crude football analogy, we kick a field goal and we come back and aim for a touchdown on the next drive. I want to say, though, that, you know, activists on the ground, as we think about where we need to go from here, let's not forget to bring it full circle what COVID-19 showed us regarding our health system. And let's not forget to focus on those issues as we advocate for why Medicare for all is one solution to many problems, whether it's the lack of resilience in our healthcare system, whether it's the failure to protect people from the loss of their healthcare if they lose their employment, whether it's the fact that when you force people to pay for healthcare, you are going to, by definition, exclude people from coverage. All of those things are solved if we were able to move forward on Medicare for all. You all are doing that work every day. I'm really, really grateful to be able to walk that path with you, and let's keep going. That fight never ended. It will continue until in this country we have finally dignified the value of our fellow countrywomen and men by guaranteeing them the fundamental right to healthcare. And that fight is worth fighting every single day.
Thank you so much, Dr. El-Sayed, who is just a giant in our movement and doing working at many different levels. And so thank you so much, and for taking the time to inspire the grassroots activists who are doing this work at the local level. So thank you so much. And once again, I just want to say, you know, we've covered a tremendous amount of ground this evening, from Congresswoman Chu to Council Member Williams, Dr. El-Sayed, and the amazing activists who are doing the work at the local level. But we always try to, and Marti Garza as well, try to highlight both the importance of the movement building and the expertise and the importance of our political leaders taking stands that they need to take. And so while we're really trying to make sense, I think, of these confusing times and what all of this means to us, I think what's clear from tonight and what we've been hearing from everyone across the country is that our commitment to one another and this movement really does remain strong, that we're resilient. We're coming up with new ways to connect virtually in our communities, to hold our elected leaders accountable, to counter the misinformation that's being spewed by industry about Medicare for All, and to care for those who are most vulnerable in this crisis. So I've been thrilled to see the engagement that everyone's had on the chat and the connections that people are making during this webinar and beyond. And I'm grateful to each and every one of you for joining us this evening and for being a part of this movement. We will continue, we'll be having our next webinar in 4 weeks, which is Thursday, June 25th at the same time. And if you want to give an update on an upcoming webinar, please let us know. And again, thank you to Congresswoman Chu and Council Member Williams for joining us and for being a part of this. So thank you very much, and we will look forward to being in the trenches with all of you. Thanks so much.
Bye, everyone.